materials the best. We got to explain pain, which is quite a lot of great studies based on this book. Lorimer Moseley, David Butler, the most influential people in pain education. I need a show of hands. Who here has actually read the entire book from beginning to end? Good. The majority of you. Wonderful. Now the challenge I have is I've had trouble getting majority of my patients to begin reading it. It's deep. It's got NMDA receptors, substance P, and calcium channels and stuff like that. And it takes a few hours. Now, the recommendation how much time we should spend on pain education varies. We've got everything from 10 weeks, 1-hour sessions, to 5 weeks, 15-minute sessions. So we don't really have a timeline. But all I know is this is excellent, but it takes a long time. Why Do I Hurt? Adrian Lowe. I wonder how many of you have read that? Good. You guys are all like, you realize in an average clinician population, that many hands would not go up. And then I'm curious about, I wrote this book so it could be read in 20 minutes. And it's written at a grade 3 level. So it's a very easy reading. It's not compared to either of those two. It's nothing that I compare it to. So who has read The Pain Truth? I'm just curious of the show of hands. All right, it's a simpler version. Painful Yarns, Lorimer Moseley, excellent book. Avoiding the Internet, that's not a good pain education session, except the websites that we've recommended. This is Greg Lehman's book stuff. So the question is, how much time do I have? Now, you can devote as much time as you want to any of this stuff, but again, as a busy clinician, I want to see if the patient's appropriate for pain education in the first place. Here's the challenge. I don't think it's appropriate to give pain education if you don't have therapeutic alliance with them. Meaning on the first day, if you haven't built a connection and you give them this stuff, you're going to lose them. The chances are high they're going to say, you're an idiot, I don't trust you as a clinician, I'm going to go seek care from somebody else. It may take 2 sessions before you have therapeutic alliance, it may take 3, or you never make a connection with them to say, yeah, they trust what you're telling them. So the analogy I like to give, it's called an apothecary scale. Now, the book that David Butler and Lorimer Moseley wrote is called The Dims and Sims. I just like to say, well, they talk about this. I wrote about this before they did. So I didn't steal it from them, but I give them full credit, though. So they're far more popular than I am. I just want to say, in case there's an overlap, it's because yeah, so this is the apothecary scale. To keep you alive, your brain is subconsciously and constantly judging if you're in safety or in danger by calculating how much physical and emotional pressure or stress you're experiencing. So I tell my patients that, and I literally read them that one sentence. I went the wrong way. If the scale tips more towards the danger side, the brain and the nervous system become more hypervigilant and sensitive to pain. They seem to understand that or accept that. And if the scale tips towards the safety side, the brain and the nervous system calm down, remain relaxed, and become less sensitive to pain. Yeah, they understand that. If you're more relaxed, you have less pain. When the scale favors the safety side, the brain produces powerful chemicals that help reduce pain, such as morphine and serotonin. That's about the extent of my pain physiology education. They understand that morphine's good, and everyone pretty much knows the brain produces its own morphine. However, when the scale leans towards the danger side, the brain stops producing these powerful chemicals. Now the question is, what makes the scale tip more towards that way? So what we're going to go through right now for the next 10 minutes, we're going to go through the questionnaire, which is in your booklet, right? You're there, page number, whatever it is, 5. We're going to go through one question at a time, and I'm going to go through, and you're going to do this in real life. Now, if you have no pain, no discomfort, no functional thing, answer it as accurately as you can. All right? No one's going to read your book. No one, you can throw the book away, but I need your full participation. So you're going to circle the number that best accurately represents your D score. There's 20 questions, 10 for D, 10 for S. No, don't do it yet. First question is about pain stress. Here are the facts. The association between post-traumatic stress disorder, PTSD, and pain intensity was mediated by pain catastrophizing, fear of movement. Now, I can go through, hundreds of studies associating pain. The higher pain stress is, the more pain you have. In extreme cases,